Thank you very much and good afternoon. Starting with our immunization vaccine update today. As of today, 71.8% of all adults over 18 in BC have been immunized with one dose of vaccine, and 68.9% of everyone 12 and over have now received their first dose. And that is 3,104,143 doses of all three of our COVID-19 vaccines have been administered in British Columbia. Of those, 229,585 are second doses. For our update on cases today, we have 199 new people diagnosed with the COVID-19 in British Columbia, 3 of whom were epidemiologically linked cases, bringing our total number of people diagnosed with COVID-19 to 144,866. Of the new cases, 68 are people who live in the Vancouver Coastal Health Region, 89 people live in the Fraser Health Region, 2 people live in the Vancouver Island Health Region, 34 people in the Interior Health Region, and 6 reside in the Northern Health Region. We currently have 2,563 active cases, 224 people in hospital, and 62 of them in critical care or ICU, and 140,537 people in BC have recovered from COVID-19. Sadly, again today, we've had 2 additional people in British Columbia who've died from COVID-19. Both of them were people in their 60s, and that brings the total number of people we've lost to COVID-19 to 1,709. And our condolences go to all of those who have lost loved ones. We know how challenging it is at this time. We currently have 5 active outbreaks in long-term care and assisted living, and 1 in acute care in the province. Last week, I shared details of our approach for dose 2 for people in our main age and risk-based program, immunization program, using Pfizer and the Moderna vaccines. And as you know, we've shortened the interval between dose 1 and dose 2 to be at minimum 8 weeks compared to the 16 weeks that we were working with early on. And we know that many people have started to book their second doses, and we've been particularly starting with our elders and seniors who received the vaccine first, as well as people who are clinically extremely vulnerable. And I know that's been actively going on all week. On Tuesday of this week, the National Advisory Committee on Immunization provided updated guidance based on evidence from around the world on what we call vaccine interchangeability, which means having a different product of the same type of vaccine or a different vaccine for dose 1 and dose 2. And we recognize that many people right now are about 10, 12, or 13 weeks after their initial dose of either Pfizer or Moderna. And I want to reassure you that that is safe, and it gives your body's immune system time to ramp up so that you do get an adequate and durable, longer-lasting booster when you get your second dose. Any time between 8 and 16 weeks is good, and we know that in some cases a little bit longer is actually better. What is important is that everybody does need to receive 2 doses of all of the vaccines that we have here in British Columbia. As always, it is, as we do for vaccines, for all vaccines, it is always preferable to have the same vaccine for both doses. But we now know from the work that we've received, as I mentioned, from the National Advisory Committee, the BC Immunization Committee, and the data that we've reviewed from around the world, that it is safe and effective to have a different vaccine if you need to. This approach is based on scientific evidence and the guidance of NACI and our BC Immunization Committee. So I know that our immunization teams across the province are doing their best to make sure that if you receive Pfizer for your first dose, you'll receive Pfizer for your second dose, or Moderna for your first dose and Moderna for your second dose. And this is interchangeability of the same type of vaccine, so the mRNA vaccines. What we do know that it is safe to have either one if that is needed. It's equally safe and works just as well to have either mRNA vaccine, and that's based on the data that we have now from experience around the world. This will mostly affect people who had Moderna right now as their first dose, because we have had some spotty issues with supply of Moderna. I will reassure you that we have more Moderna coming. We've been guaranteed that by the end of this month. So this is a temporary issue, and we are doing our best in every clinic to make sure if you received Moderna that you'll have it available to you. But there will be some instances where it may not be available. In that case, you will be offered Pfizer as an alternative to the Moderna for your second dose. You can choose to rebook later in June when more Moderna is available, but I would encourage everyone to take the vaccine that you are offered when you go in for your second dose, and you can be reassured that we have looked at this evidence now with millions of people. It is safe and effective. And today I want to talk a little bit about the other vaccines that we have here. For those who received AstraZeneca for your first dose, you will have a choice for your second dose here starting next week. And I want to say specifically for the almost 280,000 people who received AstraZeneca, you did make the right choice. AstraZeneca is an important and life-saving part of our BC immunization program, and it was absolutely essential when we had high case rates and increased transmission in March and April. Your making the decision to receive AstraZeneca was a good choice to protect you and to protect your community, and is one of the reasons that we've been able to manage to stop transmission in our community in British Columbia. As more mRNA vaccines, particularly Pfizer and Moderna, became available, we no longer needed to have an additional vaccine in our armamentarium, and we were watching what was happening around the world, as well as the very real but rare risk of having blood clots from AstraZeneca. So what we made the decision to do was save the doses that we had on hand so that we would have AstraZeneca available for people for second doses when the time came, and to make sure we were not unnecessarily taking additional vaccines out of the global supply when it was needed so badly in many other countries. Now, with the evidence that we have that mixing and matching of different types of vaccines, so the viral vector vaccine that AstraZeneca is with messenger RNA vaccines, either Pfizer and Moderna, is also now safe and effective, and we know about the safety from data from the UK, as well as the effectiveness from studies and use in places like Germany, in Spain, etc. So people who received AstraZeneca in March and April, you have two choices now. You can receive a second dose of AstraZeneca vaccine, and we will ensure that we have enough AstraZeneca available for everybody who wants to receive their second dose of AstraZeneca. And this, we've been working with the Pharmacies Association and making sure that we have operationally and logistically the ability to get vaccine to pharmacies. So people who received AstraZeneca and want to receive your second dose of AstraZeneca after at least 8 weeks, it will be available to you through pharmacies. And that will be starting on Monday. We're shipping out over the next few days. And the pharmacy where you received your vaccine will be in contact with you to set up those appointments. And I'm asking you, please, do not call the pharmacies. We are working it through. Almost everybody who received AstraZeneca is in our registration system already. If you're concerned about that, you can go in to get vaccinated and check. And we are working with the pharmacies to make sure that they can effectively and efficiently call you and schedule you for your second dose when it's ready and when you're due. The other option that you have, if you wish to, is to receive a messenger RNA as your dose 2. Again, after 8 weeks minimum. And there's some evidence that waiting for both of these to 12 or 13 weeks is somewhat better. You can receive a dose of the messenger RNA, so Pfizer or Moderna, through our mass clinics across the province. So you can expect to receive a text or email inviting you to book about 8 weeks, a minimum of 8 weeks after your first dose. And invites will start to go out this Monday. So it takes time for us to get all the logistics worked with all of the pharmacies across the province that are working with us on this. If you received your vaccine at a pharmacy, they will contact you. Please do not call them. We know that sometimes it can be anxiety-provoking, but they have a system that they're putting in place, and we're working with them to ensure that they will be able to connect to people in sequential order of when you received your vaccine. They will not be accepting appointments if you call them. If you choose the mRNA vaccine, Pfizer or Moderna, you can use the booking invite for your second dose through the Immunize BC platform. So that is what will start to happen starting next week and will roll out over the sequential weeks. As we all know, and I know I've heard from many people, our clinics are very busy, and that is a good thing. It means lots of people in British Columbia are getting vaccinated every day. We have plenty of supply, and the deliveries are coming in every week. But I can tell you the number of appointments that we have in our mass clinics match the available doses that we have every week. And the clinic teams are using every last dose. We've talked before about the schedules. We have now regular schedules with Pfizer. They usually arrive on Monday afternoons or Tuesday mornings. And that means that through the weekend, we have to be very careful in making sure that we're titrating every dose. We know with some of the drop-in programs and the pop-up clinics that we've had, or the low-access clinics, we can use vaccine very quickly. And those are titrated to make sure that by Monday afternoon, we have very little left. And we would be able to immunize another 100,000 people a week if we had vaccine supplies. But right now, every appointment is titrated to the vaccine that we have coming in every week. So when you're invited to book either your first or your second vaccine, it may be a few weeks ahead that you will get your appointment. Clinics have been accepting youth drop-ins, as we know, when children come in with their parents or a trusted adult. But we recommend that you book everybody, no matter their age, so that we can make sure we have enough vaccine at every clinic as we go on. As I mentioned, we know that the minimum 8 weeks is okay, but there is no risk to waiting a little bit longer, and in some cases it gives your immune system a chance to ramp up and then get extra protection from the booster, from the second dose. I will also say we will have enough vaccine for everybody to receive their first and their second dose by the end of summer, and very likely much before that. So we all need to be patient, and we know how exciting it is to get protected through vaccination. We know how effective these vaccines are and the difference they're making in us getting through this pandemic and moving on to the next stages of restart here in BC. We're making great strides, and we want to keep that momentum going. There is enough supply for everyone, and we want to get everyone fully vaccinated as soon as possible. Your second dose is just as important as the first dose. So yes, it is important that you get both. And of course, if you haven't already done so, please make sure you're registered, and that is the vaccine fast track to getting both your first or your second appointment. Today, as I mentioned, the AstraZeneca vaccine is getting shipped to pharmacies throughout BC, and their teams are preparing to invite you back starting next week. In the meantime, we do still have COVID-19 circulating in our communities. In some areas, we're still having outbreaks that are affecting people, and we know that people are still getting seriously ill with this virus. So we need to keep doing what we're doing, to be cautious and to make sure that we know who we're spending time with, where we're going, if we're feeling unwell, to stay away and to get tested. We know that we're on a good path, a slow and steady and cautious path to restarting and getting through this pandemic. And we will get there in the coming weeks and months. And let's also remember that to continue to be kind and to be calm and to be safe.
Thank you very much, Dr. Henry, and I want to start by expressing my condolences to the families, the friends, the caregivers of the two people who passed away related to COVID-19 in the last 24 hours, one in the Fraser Health Authority, one in the Vancouver Coastal Health Authority, both in their 60s. It reminds us of the negative power and the power of the COVID-19 virus and why we have to continue to take actions together to protect one another. But it also reminds us that this continues to be a difficult time to grieve and why we need to support all those in their communities who have lost loved ones in this public health emergency. I also want to reflect on the public health emergency with respect to the overdose crisis and our thoughts with all of those families, of all those friends, of all those caregivers, of all those communities who are so profoundly affected by both of our public health emergencies. With respect to vaccination, our teams are doing, I think, an extraordinary job. Across British Columbia, 71.8% of adults have now received their first dose immunization. 68.9% of all those over 12, all those eligible for the vaccine, have received their first dose. Yesterday, you'll know, it was a very large number, more than 20,000 of our more than 60,000 doses distributed yesterday were second doses, and more than 40,000 were first doses, and that will continue to be the case. So I want to say that the week ending June the 1st, our teams delivered around 380,000 immunizations across BC in that week, in a week where we received, as you'll recall, 276,000 doses or so of Pfizer, and we had received the previous week doses of Moderna. So as Dr. Henry has said, we are delivering these vaccines into people's arms, consistent with the vaccine arriving in BC, and I think the organization of this across hundreds of locations in our province is a real tribute to our teams, led by Dr. Penny Ballum, led by Dr. Henry, but as well are all the individuals who've been involved in this process, from those doctors and nurses and ambulance paramedics and firefighters and others, and pharmacists involved in the direct delivery of vaccine, to all those involved in organizing it who have joined our effort. This is a true community effort, and we are truly honored by all of your service and your commitment to one another, and to all of those who are filling our appointments. And if you ask, when people say, why are 95 to 100% of appointments filled in a particular location, it's because that is what we want to see happen. I note that our hospitalizations today were 224, which is down from a height of 511 at the height of the second wave, that those in critical care are at 62, down from 183. What we are seeing in our healthcare system, and I think this is evident to everyone, is a return above the levels of other hospitalizations in our healthcare system, such that yesterday, for example, we had 6,678 emergency room visits. In the early part of the pandemic, we talked about the reduction of emergency room visits for other reasons, and the comparison was 6,559, which had been the number of people visiting emergency rooms on March 9th, 2020, which was a pre-pandemic level. Equally, yesterday we saw the third highest number of ambulance dispatches in the history of the BC Ambulance Service. The previous ones had both been essentially New Year's Eve, New Year's Day, 2017 and 2018. So yesterday was the third highest in terms of number of dispatches of our ambulance service, and all in the last number of days, 4 or 5 days, has been significantly above the previous or pre-COVID average. So I wanted just to express my ongoing appreciation, just to update you on our surgical renewal commitment and where we are today. Last week we released our 2 most recent surgical renewal commitment reports covering the period up to March 31st. The reports show that we continue to change the way we're delivering surgery in BC, and that through these efforts, 97% of the patients whose surgeries were postponed in the first wave still wish to have surgery, have had their surgery. This achievement should, I think, give additional reassurance to patients whose surgeries were postponed because of the third wave. Last week, we also announced the resumption of non-urgent scheduled surgeries in Metro Vancouver. We said we would bring Burnaby back to full operations on May 25th, and we did. We said we would have Royal Columbian and St. Paul's hospitals back to full operations between May 31st and June 4th, and we did. They're now at full operations. And we remain on track to have Abbotsford, Surrey Memorial, Lionsgate, UBC, and Vancouver General all back to full operations by June 7th. Since last week, as you are all aware, a COVID outbreak at Richmond Hospital, which has closed one unit and 20 inpatient beds. The outbreak has resulted in an overflow of medicine patients into surgery and limits the hospital's ability to use all of its operating rooms. Richmond Hospital will focus on delivering surgeries that do not require an overnight stay. Full capacity, originally expected to occur by June 7th, is now expected to be achieved by June 24th. This setback underscores why will our vaccination efforts accelerate, and that progress encourages us. The chance for COVID to gain a new foothold and set us on our heels is still the work of the moment, and our battle to stop the spread is by no means over. Today, I'm also reporting that 153 surgeries were postponed from May 24th to May 30th. This means that a total, that was 40 in Fraser Health and 113 in Vancouver Coastal Health. No surgeries were postponed in any of the other health authorities. This means a total of 2,306 surgeries were postponed from April 19th to May 30th. From May 17th to May 23rd, health authorities completed, still, in spite of that, 7,120 surgeries, of which 5,598 were scheduled surgeries and 1,522 were unscheduled surgeries. By health authorities, that's 1,860 in Fraser Health, 1,427 in Interior Health, 406 in Northern Health, 1,585 in Vancouver Coastal Health, 1,533 in Vancouver Island Health, and 309 in the Provincial Health Services Authority. The outbreak at Richmond Hospital, which involves 11 people, makes it clear we must continue to use our COVID skills consistently, follow public health guidance persistently, and adhere to public health orders diligently. We must continue to register for our vaccination. 1-833-838-2323 is the phone number. The Get Vaccinated website is the easiest way to book, to register, and to book your appointment. And we have to continue to take great care in our actions and behavior to give that shot every chance to give us the best protection possible. I want to appreciate all of those working in supporting us in the COVID-19 pandemic, and everyone in communities such as Richmond, in Rutland, in communities such as Surrey and others. We have seen very significant uptake in immunizations over the last week again. In Surrey, all but one of our community health service areas, of which there are 9, is now above the provincial average for immunizations. In Richmond, we've seen the gap close between where they are in Richmond and the provincial average significantly this week, and continuing to do so, and especially an increase in registration. We're very proud of the communities of MLAs and community leaders and the mayor and everyone else who've been part of that effort. So thank you very much. Thank you to everyone in the community, and we're going to continue to make those efforts in all communities, from Fort St. John to Cranbrook to Fernie to Terrace to Vancouver to Victoria.